大家好，这个第一次被叫来讲英文，不过希望大家上这堂课能够非常有趣。那我们就开始 switch 到讲英文。Right, today I want to talk is that about the surgical route in organ system and some derived medical terms in surgery. And after that, I will say something happened in operation room. Maybe you are interested in surgery. So today I want to not to talk about a lot about bodies because the previous one already talked about the body. So almost the same. And maybe next year, next semester, you have to learn about anatomy. So it's a big challenge. I'll give some talk about this challenge, okay? Evolution of the surgeon. Why we call it a surgeon and what it happened and when did it become a surgeon? This term is that in the 19th century that introduced anesthesia. Before that, all the surgery that's doing that without anesthesia. So you have to sustain a lot of pain, and if you go through the pain, you survive. If you cannot go through the pain, you'll be died. So that's easy, okay? So at that time, the surgeon just like healing somebody, okay? But after that, after introduced a good anesthesia and some antibiotics, so made the surgery possible, and we could correct the deformities. So now from that on, we became a surgeon. And from 19th century to early 20th, orthopedics become popular because we can transfer some tendon, some part of tendon, and some part of bone from one way to the other side. Okay, so that's made surgery possible. So orthopedics found that we can transplant a tendon, so that made the surgery more popular. What you can see there. After this, salon, right? Hair cutting. So once you select the logo, you could go in and let your hair cut or make some hairstyle. But why I want to show this? That's because there's a lot of that flag. Which country? France, right. So the surgeon, all the surgeons and the developed surgeon that comes from Europe. And why what's the connection? Maybe some clue, right? So I want to tell you that why I am a surgeon and what the surgeon goes through, okay? That's some in body, you got sick. Maybe some element quite different and no balance. So you have to make it balance. Okay, make it balance. And how to make it balance? It's so easy. That's because function, okay? Let's breathe. Let's discharge some unbalanced tissue. That's a blood. So it's easy to discharge it, okay? And so let's cut it and let the blood comes out, and then your body will be clean and become healthy. So at that time, 欧洲放血是康复知识 ，but surgeons, doctors do not want to do that kind of things because that's a dirty things. Okay, so who wants to do that? Okay, let us share your mustache, right? And use the cut, the knife. Just take a little bit of the knife and then cut the blood. Cut the vessel, the blood will come out. So that's the complicated. After the surgeon, become a surgeon. Okay, become a surgeon. That's real. Become a surgeon. And 1540s. That United States together. So the doctor become a surgeon. Okay, such a real, they become a surgeon. So at that time, the doctors do not want to do that kind of thing. Okay, and from there on, they have surgeons, professional one. Okay, so after that, the health company is another kind of surgeon. And but 70 to 45, that separate, but they still use that kind of logo. Okay, so that blue one, blue one is the vein, red one is the artery, and the white is gauze. We combine these three together. So that's why their cut shop has a logo on the outside the door. That's their symbol. And because that's a long time ago, they are also a surgeon, okay? But after 17, they're separate. So right now, they're separate into a physician and surgeon. So that's a history. So the surgeon, why the hair cut shop before that they are symbol like that. And I want to say that orthopedics, why that's from Greek word, that's a 骨科, orthopedic doctors. And that's derived from this 16th century. Okay? That's an ortho, that's a straight and free from deformity. So at that time, orthopedic surgeon is not a surgeon. That's more like our bone setter chiropractic. That's just want to change the deformity gradually, not to cut it, not to correct it, okay, by surgery. They just do it by manipulation. So that's a kind of a chiropractic. So also that means the free from deformity and failure as a child. So the words become, say, the meanings, the words that correct the deformity since the childhood. So at that time, orthopedics, just like a chiropractic doctor, not a real surgeon. Okay? So that's orthopedic, the art of correcting and preventing deformities in children. So that's our logo, just like this. Want to correct the deformed tree and use the straight rod to correct the deformed tree. So at that time, the orthopedic surgeon is just only to prevent the deformity. If they already have some deformities, they do nothing. Okay? So just correct it. But after World War I, that became more popular because during that time, anesthesia become very, very popular and used some antibiotics to prevent infection. So after that, surgeons have a lot of experience in doing, orthopedic surgeons a lot of experience doing the surgery. So after that, we became a specialist. Okay? So it's an instrument. So during World War I, if ever got hurt around the leg, orthopedics just only cut the leg within 10 minutes to save the life. So during that time, they have a lot of experience to do the amputation, to do the open reduction of the bone fracture. So during that time, that's the first instrument kit. There's a knife, some tools to cut a bone. Quite easy, okay? But what's the difference between the surgeon and physician? Somebody always do not like to do the surgery because they are so simple, right? If they see the bone fracture, just repair the bone. See the muscle rupture, repair the muscle. They do not have any knowledge, okay? So our thinking is quite simple. quite simple thinking. The surgeon, they know nothing but do everything. Okay? They just only know how to cut, how to go inside the body to see what happened. So that's quite different. And the psychiatrist, they know nothing and they do nothing, just only tell you everything, right? They tell you everything about that, but they do nothing, just only talk. And what means talk? They got a lot of money, earn a lot of money, right? So, but they know something, promise everything, and do nothing. Okay? Right? That's really interesting. But we just only, so become a surgeon, you just only have to remember some key words. That's enough. Keywords. Our keywords is very simple. The previous doctor already had teach you about the colors, cyanosis, in the blue and the like some black, and micro, tiny, micro and macro, mega, anterior or lateral. The combined together is anterolateral. The semi-anterior, semi-lateral, the anterolateral. Okay, it's quite easy. So we just put two things together. Lateral level, that's a middle. That's like ophthalmos, or likely to write that. And the others that is near material, that's not so. You have to remember another medical term. Not remember that easy to use it because when you become a doctor, you have to use this word. I want to say this key word. Why I want to say key word? Just like itis, just like arthritis. That means that artery inflammation change. Okay? If I put osteoarthritis, that means what? Osteo, that means bone. Arthro, that means what? Joint. Arthritis means osteoarthritis means bone and joint inflammation. Right? So that's a for some 关节炎. So that's a degenerative joint arthritis. That means 退化性关节炎. Okay? So that's we always put something together. So you just only have to know what it means. Then you guess something. So that's quite easy. Oma, that means tumor. And just like this. Osis, some condition. Just like osteo. That means what? Bone. Right? Poro. Poro means some many holes. Okay? So let's put it together. Osteoporosis, that means in the bone there are the holes. So they will be cracked easily. That means osteoporosis, that means susong. So like quite easy to understand. If you know the terms, that's all easy to understand, okay? And I mark it into red, that's more important for the surgeon. Atomy, stomy, that's quite different, totally different. Atomy, that means that we take out something. Ostectomy, take out some part of the bone, right? And stomy, that's you not two things together. So, quite different. If you write the wrong words, then we'll do the wrong surgery. That's quite important for you. Basis, that means that like use the glue or any kind of instrument to join two joints together. That means basis, okay? So, previous doctor already said that the cardiovascular system, that's a vascular vessel, angial, artery, that's arterial. I think you already read about that, so I won't to say a lot. But treatment, muscular, is quite important. Just like arthrotomy, scopy, that's use the tiny hole to look inside, the scope, use some tube to look inside. Astrosynthesis, that aspirate something out. So just like gastrostomy, treatment, they totally different. They take it out or suture it together. So that's different words. So you have to remember the keyword and rather than the keyword, not another one. During operation, aspiration, that's a suction something fluid out. Okay? Seize, these two things that's to cut, and clamp, that's grab something. So you have to remember these terms, then later you have some instruments you need to use. Clamp and curate, remove some tissue, scrap some tissue out. That's a curate. Okay? Dilatation, that's enlarge or opening something. And endoscope, that's use some scope to do the look inside. And ectomy, that's incision. So gastrectomy, that remove stomach. But gastrostomy, stomy, that means repair the stomach. So these two words are quite different. So you have to remember like this, okay? Then process, also grab tissues, and GA, general anesthesia, that's a totally loss of conscious, and then during operation is no pain. And OR means operation room. Otomy, incision, and cut to see inside, that's otomy. Plastic, that's a repair, some surgery, dermatoplasty surgery, that's a surgery repair and skin. Okay? And arthroplasty, that means what? Arthro means joint, right? Plasty, that means the surgical repair. Arthroplasty, that means the joint repair, joint resurfacing. So totally knee joint replacement. We also say some a total part of a joint replacement. That means arthroplasty. Okay. So plastic is a surgical repair. Post-operative is after surgery. It's easy to understand. Okay. And some scalp resection, take out something, cutting. That's easy to understand. So I think you have to know these important medical terms. And said, if you tell some patient to lie on this table or lie on table, you have to say better to say that lie on the table. Why? That's not the medical grammar problem. That's because a common use problem. If you write lie on table, the surgeon will tell you maybe go out. They will be very angry because lie on table in operating room. That means that during operation the patient lie on the table. Okay, that means on table. So it's not good for you to write lie on table. That's not right. Okay, so that means the surgeon do nothing right, and somebody lie on the table, that means on table. So that's a medical terms, not to say lie on table. Okay. So another medical you have to remember. Just like this. Okay, there's a femur, the long form of a femur shift. You have to remember another medical term just like this. It's a head, femur head, femur trochanter, and femur, and it's a shift. So, in a semester, you're reading anatomy. You have to remember a lot of medical terms, just like this. And only this? No. You can remember a lot of medical, just like this. Every keyword, every medical terms you have to remember. So there's a trochanter, greater trochanter, gluteus incapacity. Is that enough? No. But now, all you have to remember, okay? So, for example, have you seen a doctor? Simple sentence. Yes, the doctor at the clinic has told me there is serious nerve compression and has just suggested an operation. Okay? More commonly, just only add and. Okay? And. Two sentences put together. Okay? Very simple. So, you don't have to worry about the English. It's a simple. Alright. So you know there's going to be an operation? Okay. Simple. Okay? And yes, I want to talk about it. Right? Okay, let's check your muscle power and lift your feet and push against me. Like this, okay? So, all the words are so simple. So don't have to worry about that. So you just have to write it in simple sentences, that's okay. Because we do not want to write the very complicated. Because the English is only talking with others, okay? So, then, going to physical examinations, you just only have to do some inspection, palpation, and position, and some measurement and examination. So, that's a surgeon have to do like that, just like orthopedics. After that, you have to use some instrument tool to examine the bodies, just like the tomography, CT, MRI. You always say that MRI, arthrography, arthro, that comes out again. Arthro means joint, right? Joint, graphy, graphic. Just like use some dye to make it more clear. The arthrography, mammography, and scanography. Graphy, some graph, okay, some picture. And the same during operation. Ectomy, otomy, all the same. Arthro again comes out. Arthrotomy, then open the door, right? Joint, open the door, open the hole. Synovectomy, synovitis, syno, that's a wala. Synovectomy, take it out. That's easy to understand. Okay, tendinotomy, capsulotomy, capsule, open the door, open the hole to see inside. That's it. So, that's operative, field operation treatment. The term is quite easy to understand. Just only know the key words. Only have to know the key words. The bone posture, the same. Osteotomy, comes out again. Osteotomy. Open the door, right? Open some hole in the bone. Arthrodesis, arthrodesis, arthro, that means a joint. Basis, united together, so fuse the joint, okay? That's quite easy. Arthroplasty, the same. That means the total joint replacement, that's a part of arthroplasty, okay? So that's quite easy to put in these two words together. Okay, during operation, a lot of instrument you have to use. A lot of instrument you have to use. So you have to remember some instrument. Just like this. Generally speaking, we say it's a forceps, right? That grabs something. But there's some difference. There's a teeth inside. There's a smooth one, okay? So in operation room, we always say that teeth, give me teeth. That means there's some teeth around teeth. Then they can grab the skin, okay? And easy to grab skin, okay? And this is smooth. If you want to grab some artery vessel, there's no tools to damage, no teeth to damage the vessel wall, okay? So in the operation room, we will not say forceps, we say that teeth is smooth. That's okay, everybody know that. But in America, maybe some doctors will not say forceps. They want to say, I want to say that pick up something. pick up something. So they say this is pick up. So these are some medical commonly used words. So in operation room, you always got that piece or smooth. There's two kinds of instrument. Okay. So some you have to know a lot of just like that. Anesthesia boom, just like that. This one. Okay. And after that, when patient lie on the table, you have to know that's electrode. And you have to use the pulse oximeter. That means measure your oxygen. Is it quite enough or not? Okay, and this one is the blood pressure cuff. During operation, you have to use the blood pressure cuff to monitor your blood pressure. And there's an anesthesia mask that you totally lost of conscious. There's a general anesthesia. You have to use the anesthesia mask. And this is IV stent. Okay, there's a light. So that's almost the same. So you have to remember some keywords in the operating room that you have to know. That's easy one. That's not so complicated, but you have to know that. And in operation, you cannot raise your hand. Just say that my turn, because that's a good. Okay, explanation is good, but you cannot raise your hand because the clean area is around your chest. Above that and below that, that's a dirty area. So you raise your hand, the chief surgeon will say, get out. Okay? You'll be put out in this group because that's already 31. And during the operation, the surgeon will concentrate. Okay? You cannot raise it and disturb operation. So during operation, some surgeons do not want somebody to ask some questions. And some surgeons, that's okay. And every surgeon has his own tempo, has his own character. If some surgeons have bad words, this is a modern operating room. That's a table. Patient lie on here, right here. And this is a surgeon. Surgeon not stand beside the patient. It's sitting far away from patient. All surgery, during the surgery, we use the instrument. These are robotic arm. They control the robotic arm in this set. This is another surgeon. So that's a table. The patient lie on here, and that's a robotic arm, and somebody operated on this machine. Okay, so that's a surgeon, chief surgeon, that's a patient. So that's quite different. They sit in different areas. So I'll show you the video. Here, that's a video. Quite different. Okay, that's a video. That's a use the robotic. That means Da Vinci. Okay, they use a Da Vinci to operate this operation. Okay, the operator uses the arm, the joysticks, then the robot hand control it. So this is the paper, the holding the paper. Okay. There's a fancy surgery, just only the surgeon could do. The physicians cannot do this kind of fancy surgery, right? We know nothing, but we can do everything. surgery. So right now we could use the robotic surgery to do some. We could use robotic to do some very fancy surgery. Okay. So that's a surgeon. What happened in surgery? That's a modern surgery. So in the future, we do not know. We do not have to operate on the body itself. We just only sitting away from the body and then use the instrument to use the joystick to operate it. That's right now happening in a hospital, right? So if you're a surgeon, you could touch this kind of instrument. That's a quite fancy one, okay? And okay, this one, that's what I do. That's a microsurgery. That use a very tiny thread, tiny suture, anastomosis the vessel. So some kind of amputation. Then we could do the microsurgery. That's a microscope. Use a microscope to do the tiny surgery. So that's another art of a surgery, okay? So we do another of this kind of microsurgery. But right now, there's all go abroad to China. So right now, we are not so many amputations in a hospital. So I could show you. That's another one here. That's a microsurgery. So microsurgery belongs to plastic surgeon or orthopedic surgeon. We could do
surgery is the type of surgery in which we put small arteries and veins together or nerves, that's called coaptation, in order to
okay. So you could heard about that talking. Let's always use the single sentence. That's quite easy to understand.
We use microsurgery reconstruction, craniofacial reconstruction, or lower extremity of the trunk to cover wounds or plates on the orthopedic surgery.
Okay, right? So they always use a single sentence to let everybody to understand it, to understand what they do, what they want to do the surgery, why they want to do the surgery, what kind of surgery they can do.
As to as we're operating on, what are the instruments we use, such as a needle driver, small pair of scissors, or small pair of forceps or pickups?
Pickup, right? Almost the same. So just only one use the some simple sentence combine together, and then you'll be a doctor. So that's quite easy. So now it's always about that.
It's always
English appears. Just only speak out. That's easy. Okay.
Thank you so much for that.
So that's another good video for the open. I just want to show you some microsurgery. There's some instrument. Just stretch, okay? Okay, this I'll show you. Okay, this one. This is suture material. Nylon suture material here. And the needle, the needle that's right here. So we use a dual forceps to grab the needle. Here is the needle. There's a so tiny. There's a diameter that's in your hair. So if you want to do that, you have to do it in the microscope. If you just drop it on the floor, you cannot see where is the suture now. So
this
here.
Suture that are removed from the act.
So that's a so tiny one. Okay. And in our surgery, we do like a carpenter. We always use this kind of instrument as a power drill. Just like a carpenter use the hand drill. But ours is quite different. Ours is better medical use. If you buy it in the B&Q, just only $1,000, right? But this is for men to use. Use in a human being is quite expensive. Okay, B&Q just only 1,000. This one is 1,000 US dollars. But we do the same things. Carpenter just use it. Drill a hole in the wood, right? Or in the concrete. But we drill a hole in the bone tissue. Just like that. No big difference. Okay? So what we do is like carpenter's work, but we do it in the human beings. So that's a soil surgeon want to do. And you can see we drill the leg. Okay? In operating room, that's in general anesthesia and the broken bone. The doctors use a drill and insert stainless steel wire inside the body, inside the bone to fix it together. So there's no difference between surgeon and the carpenter. Okay? So what we do is quite easy things. So we are easy brain and do the easy things. And where is broken, we just fix it. Where is the rupture, we just repair it. That's easy for a surgeon to do. So after trauma, the patient's head, the nose were broken and some infection. So you cannot put it back because the infection area, okay, the bacteria will eat the material, the nose, okay? So the nose will be destroyed. So the infection area, we have to keep it clean. Before that, we replace nose. We put a nose around here, okay? And then after the nose was not infected, and there's a clean area, then we take it out and put it back. So that's what surgeons do, okay? Orthopedics, you said that in Korea, orthopedics has a salary in America. There's an annual salary. Not bad, okay? So that's not bad in America. $350,000. That's annual year salary. You change to in Taiwan dollars, that's around 10 million, right? Wow, that's a big deal. 10 million in America. That's what we can find a order. That's a compression injury, another amputation fingers. That's 8 fingers amputated by machine. But after 4 months, you return back. So that's amazing things for surgeons to do. Okay? So we could really treat the disease or retreat the trauma and then let the patient return back his normal life. So that's we can proud of. So I'm so proud of that I'm a surgeon. Okay? So I'm proud of that I'm a surgeon. So surgeon is a good thing that we do not guess the disease. We treat the real disease, we treat the real trauma. And after that treatment, patient return back to the normal function and return back to his work. That's what surgeons do. And this class, I want to only tell you that first, that English is not so complicated. You just have to use the simple sentence and simple words, simple medical terms, and let somebody to understand what you want to know, and how to communicate, and what you want to do for the patients. And even you want to write a journal, want to write the paper, or also, we always use a simple sentence to write the paper. So we do not afraid of that speak it out. You just stand in front of the table and speak out, and then let somebody to know what you want to present, what you want to let somebody know. That's enough for you. So don't afraid, speak it out, and don't be ashamed, and then you will be more and more good at this kind of communication. Okay, thank you very much.